Hello, Instagram. Hello, TikTok. Hello, Facebook, LinkedIn, and YouTube. We're having a party over here. How you doing? A pleasure to be back, Dr. Rob. We're going to be doing this every Tuesday, 2 p.m. Eastern Time. Ask Dr. Rob a question. We had 26 entries. 26. I am not going to be able to get to all the questions. So some we're going to table for next week. Some will ask privately. And I am going to show a little preferential treatment if you write one in today. But the first thing, as always, let me know where you're from. New York, New Jersey, Connecticut, the UK. You can be specific. I'd love to see where everybody's from. But as I wait for that to come in, I'll look down at the comment section. So feel free to write them in. I'm going to start it off with a question. I got my questions. I actually have some answers here. And question one was, how to maintain muscle mass, the conversation piece of 2024, it seems like, as we age. Because we all know that we start to lose muscle mass by age 40. We lose 1 to 2% every year after age 40, up to 25% by age 65, and even up to age 70, 30 to 40%. It's called sarcopenia. We know that muscle mass is the currency of longevity, without question. Holding on to muscle mass is a great add. As we age, it slows down the aging process. It does so because I think one of the things that are overlooked is the idea of muscle mass really holding our structure, being an endocrine organ, enabling us to be able to dispense efficiently with glucose. Muscle to fat ratio is a critical add. So some of the things I'm going to recommend are weight resistance. Now, that doesn't mean go get a gym membership and see who can deadlift 800 pounds. Weight resistance comes from our own body weight. Now, within our own body weight, there's push-ups, there's planks, there's air squats, there's burpees. There's an assortment of weight-resistant type exercises. If we want to take the next step up and use cables, or use something called like a TRX, which adds to the body weight, that's a great choice. I'm a big proponent. There's some great guys that are great. They do a wonderful job. I'm trying to get a couple of them on the podcast, Proven Health Alternatives, in that they talk about kettlebells. So one kettlebell, great space, great choice for also having, the ability to flexibility. Balance is another criteria. I think balance should be a longevity search mode. Kettlebells, and then of course the next step, barbells and dumbbells. Hey Peter, great question. Thoughts on bone broth? Terrific. Love my bone broth. Everybody knows that bone broth is Jewish penicillin. It's chicken soup, right? Chicken soup without question. Great choice. Love the bone broth. My wife's got some great recipes with bone broth. We did include them in the book, Immune Reboot. I think we did. If not, that's a great hack, everybody. Bone broth, chicken soup, excellent choice. I prefer the one from chicken and or bone. That was just handed to me. There's going to be a recipe we're going to share from here today because there was a question. I have somebody here. Joan, how are you? We did meet at JFK TSA. Thank you for helping us. Appreciate it. I gave you a book. My spelling may be off. Yes. Natto. Is natto good for you? Natto is great. Natto is a longevity ingredient. So it's a great choice. Instagram, give me a thumbs up when you get a chance. Facebook, we're here. TikTok, double tap. See, I got it right. Double tap. The next question is, what's your favorite healthy recipe? Well, you can go to my book, Immune Reboot, page 189, and we talk about huevos rancheros. So huevos rancheros is like a rancher's meal. It's everything all together. So it's black beans, it's purple onions, it's cilantro, it's salt, it's gluten-free tortillas, 6 eggs, and I believe in the whole egg, avocado, aguacate, and I love the avocado because I think it's one of the best fruits that you can conceivably eat. You want to top it off with salsa. You can use shredded vegan cheese, hot sauce, and fresh cilantro. Great choice. Great way to wake up. One of my favorite meals. It's easy to put together. There's nothing fancy. Anybody can make it. You don't have to go to chef school for that. So we'll take care of that. Somebody also asked me online how I can support my immune system. Really great question. Here's a couple of things. Number one, decrease your carbohydrate consumption. Decrease your carbohydrate consumption, making sure you do not have sugar. 300 calories of sugar decreases your immune system by 50% over a 2-hour period. So watch your consumption of sugar. Eat more good quality fats. The supplements that I recommend are going to be vitamin D, vitamin A, vitamin E, vitamin K, minerals, magnesium, zinc, and selenium. Those are the big takeaways. Hey, we got Angela saying hello from Stamford, Connecticut, just about 12 minutes beyond the office. How you doing, Angela? Let us know if you have any questions. Thanks for reaching out. We appreciate it. What's the deal with the keto diets? I got to sit back. I mean, we've been talking about the keto. I do like the keto. I am a keto fan. I'm a keto proponent. It was made in the 1930s for epilepsy. It's an excellent ad for anybody that has a brain issue or wants better cognitivity, because the keto is based on 70 to 75% fat, 20% protein, about 5% carbohydrate. Fat is your clean energy fuel. Carbs are a dirty fuel for your brain. But I've got some stuff here to really share about. The real question is, isn't this keto good or not? Is keto good for a duration of time? So I printed this out. A new study led by researchers at the University of Texas Health Center at San Antonio found that a continuous long-term ketogenic diet may induce senescence, or cells or age cells in normal cells. So essentially, senescent cells are cells that die but don't know enough to die and go away, and they spew out inflammation. So the ketogenic diet over a long period of time, and they did not signify what is a long period of time, a big miss in this particular study, but it did say that it created senescent cells, which meant that healthy organs and healthy cells now had cells that were dying that were spewing inflammation. In addition, that it also recommended senolytic type of nutrients. These senolytic type of nutrients are a great choice. We will list some senolytic nutrients in the comments section. Excellent question. How can I balance out my omega-3 to omega-6 right now? It's 1 to 19. It's actually omega-6 to omega-3. There's the way they talk about it, Ange. And it's 19 to 1. What do you think for the fasting? What do you think about fasting? I think she means intermittent fasting. Really good question. So omega-6s are typically inflammatory. Omega-3 are typically anti-inflammatory. Really, we would look for a 4 to 1 omega-6 to omega-3 ratio. Ideally, it would be 2 to 1 or 1 to 1. Really difficult. However, the average American, and you are above average, which is good, is about 25 to 1. 19 to 1, it's a little too high. It's something that you want to take note. I'm happy you tested your omega-6 to omega-3 ratios. That being said, the first thing I would recommend is chia seeds. Chia seeds are rocket ships for omega-3s. They are a great choice. Eat more wild, organic, or wild smash fish, salmon, mackerel, anchovies, sardines, herring. Excellent choices. Take 4 to 6 grams of omega-3 fatty acids daily. That's 4 to 6 grams. It's a little bit up on the dose, but that's really where you need to be. And you want to try and avoid your grains. Grains like rices are very high in omega-6s. You'll be able to drop that 19 down to a 4 to 6 to 1. Overall health will be there. Fasting is a great choice. It's not such a great choice, or it's a needed choice for omega-6 to omega-3. I believe it's almost medicinal. I disagree with people out there. There are some biohackers. Well, I wouldn't call the guy who says he doesn't like intermittent fasting a biohacker. He does have a PhD. He's just wrong. And if he doesn't like it, I'm right here. We could talk about it. Put me on a podcast. Let's go for it. You know, you're definitely stronger than me in the gym, but let's talk about that. I think that we could get to some great knowledge bombs. All that being talked about, I like intermittent fasting for many different types of people. I do think that intermittent fasting Women from the ages of about 15 to 50, I'm saying menstruating women, have to use the intermittent fast a little different. Intermittent fast is a form of hormesis, stresses in the body. And within that, women don't respond quite as well to the stress because they drop progesterone. When they drop progesterone, it brings on PMS type symptomologies. So to get to the nutshell, I do like to intermittent fast women. I do a 14 to 16 hour fast for the first 20 to 23 days of their traditional cycle. The last 7 to 10 days of their cycle, I allow them to fast for 12 hours. They still get some benefits, caloric restriction. They still get some autophagy benefits, believe it or not. We can go into detail on that. And you get enough benefits and without any side effects. That's sort of like the secret sauce to intermittent fasting for women. So let's see what else we have all lined up right here. We got the deal. We got the deal for the keto diets. Best way to handle food sensitivities. A couple of answers to that question. Number one, shout out to my good friend James White at KBMO Diagnostics. It is the standard food test or food sensitivity test that I recommend without question. So number one, test, don't guess, but not only test with a company, test with a test that is accurate, like the one that I just recommended, which is the one that we'll put in the comment section, team. We'll take care of that. Terrific. So that's KBMO Diagnostics. That's the Fit 176 test. So we'll do that later. And number one thing you want to do with food sensitivities, you want to remove them. Now, one interesting thing about food sensitivities is there's food allergies. If you have a food allergy, you will know it because you'll swell, you'll get red, inflammation will increase. However, food sensitivities, you won't know right away because there's a 3-day delay from symptomology onset from the time that you ingest food. So there's no way for the patient to really know 3 days ago on Memorial Day weekend, what I ate is stimulating this inflammation. And me as a practitioner, how am I going to know? So what I suggest is a good quality food sensitivity test. Remove the foods for 3 months. You do not have to remove them forever, perpetuity. Remove them for 3 months and then either retest or slowly add one at a time for a 3-day period. That's the best way to address food sensitivities. I think that food sensitivities are one of the hidden reasons for chronic inflammation. And all my patients, when they come in for the first time, are typically too inflamed. Another excellent question. Can low-level laser aid in recovery? Absolutely. I was going to use something a little stronger like abso-effing-lutely, without question. We're never going to go there. My wife is watching. My mom is watching, so we're not going to go there. So can laser aid in recovery? I have found it to be quite effective in muscle recovery. I found it to be quite effective in recovery, in sporting events, exercise, and also in performance. In 2016, there was a study that came out that an Olympic-style event that they wanted to ban laser therapy because unless everybody got administered or got exposed to the laser, they weren't going to allow it at the facility because of such an unfair advantage to those who got lasered. So I think that's beyond recovery. I think that's recovery and performance. And I think the hidden gem to a good quality laser is the array of the different wavelengths. So you've got a violet, you've got a green, and you've got a red. You put them all together and you're able to cover all the complexes in the mitochondria. And for me right now, the number one conversation, and we can pick it up next week if you want, let me know if you want it as a title, mitochondrial dysfunction. We need to have mitochondrial function. Neurodegenerative diseases are one of the biggest reasons. They're all smiling at me. They're breaking me up over here. Okay, guys, stop. Come on, let me do my thing. Mitochondrial dysfunction is the number one reason for neurodegenerative diseases. So we want to have mitochondrial function. And a great description we'll take care of next week about mitochondrial fusion. Water, I think a great hydration drink with amino acids and electrolytes. Drink it with your cool water during the day is an excellent add. And I think I had one more that I wanted to cover before I looked. What are your top nutrition tips? Well, I'm going to coin Dr. Jack LaLanne by saying, if man makes it, I won't eat it. So you want to eat wholesome foods in their purest form. So within that, what am I talking about? Grass-fed beefs, wild fish, eggs, pasture-raised eggs, the best kind of eggs, or pasture-raised eggs. Actually, I had a post on that today. And in addition to that, leafy green vegetables, organic, good quality fruits, limited fruits, filtered water, organic coffee, organic teas. Do we have any more call outs? Anybody on TikTok? Anybody on Instagram? We're here every week. We are growing. Feel free to come in, join the cadre, join the party. I will answer everybody's questions. But for now, I'm Dr. Rob. Always yours at health.
Wow, that was full of conversation.